Thank you so much, Jonathan, for joining me today. We have been made aware that you guys have created a new piece of technology during this pandemic. Let's talk about that new piece of technology.
Okay, so, again, the ERDC team continues to be just overall impressed by the dedication of great heroes that continue to step up in the COVID fight. And again, we are more than happy to support those that are doing that. So the thing that we ended up enabling the people that are on the front lines to use the technology is called augmented reality enabled remote assist, which that again allows for the people that are on the front lines to do the job that they are accustomed to doing, but do it with less people. So we know that right now that teamwork is the overall key to the support against COVID. We've got the USACE teams that are working alongside local government officials and private contractors to make a difference for the world, but we're having to do that with less impact to our team members. So one thing that is very, very important is that we, protect the force. So even within the USACE team, we have to make sure that people are staying safe. One of those ways is by reducing the number of employees that actually go out to do the assessments, or what people may know as the alternative care facility assessments. So obviously this is a very noble calling for all of the teams that are doing that boots on the ground work. They're able to make these assessments in order to take the stress off of hospitals and that kind of stuff. But again, doing it where you would normally have a 2 to 4 person team that would be making the decisions, you're limiting perhaps to 2 or 3 people. The thing that I like to relate it to is the game show that was very popular in the early 2000s that is called Who Wants to Be a Millionaire? A lot of people remember that. And one of the key opportunities on the show was for someone to phone a friend, okay? And they were able to ask them a question. Well, that is an engineer's dream, because an engineer is constantly serving on teams of professionals where they're able to reach out to someone else. In the event like COVID, you may have someone that is very skilled in a particular area, but they need to reach out to a friend in a hands-free way that they can live stream their video to them and get some help. So when we talk about site assessments, exactly what does that mean? It means that we are looking at different facilities to determine if they meet the requirements set by different medical facilities. They may be looking at different utility requirements like electrical, lighting, water, air infiltration, ingress and egress, all the way to parking availability. So these people that, again, are forward deployed, they're making decisions that they would be accustomed to being able to have someone else on their team that might know a little bit more than they do. So with the augmented reality enabled remote assist, they can put on a headset, very similar to what you would see commercially available, like the Microsoft HoloLens. They can put it on, they can dial into an application and have their team members virtually support them during the inspection. So they can hands-free stream their video. The person that is on the front lines doing the assessment has the ability to provide some augmented holographic annotations in the scene, and they're able to basically ask people that might be, back at the home station questions. And, what does all this do? It helps us to deliver these assessments to FEMA, on the schedule that we have, committed to doing so. So when we look at this, it also enables a technology to where you can place a design or a renovation design in the physical location in which the renovation is going to take place. So regards to like a hotel conversion or perhaps a dormitory conversion into a healthcare facility, you're looking at how's that medical equipment going to fit within that physical space? Is there going to be enough room for the nurses and doctors to walk around and do the procedures that they need to do to take care of the patients. With augmented reality and with other teams throughout USACE, we've been able to place those virtual models and allow the field staff to walk around and give vital comments back to the architects and engineers that are changing those designs to fit the specific location in which the renovation is going to take place. So what would have taken, let's say, weeks is now limited to just a few days in order to provide that assessment to the decision makers. And again, we're serving and in support of FEMA and the local governments and those kind of things. When we talk about the average length of these conversions, again, we're looking at an average of 5 to 14 days. So our standard operating procedure, doesn't allow us to make decisions in a vacuum. We have to be moving forward continuously, and this technology supports that vitally.
So